Namaste, Dr.
Namaskar.
Shashikant. It's nice to have you with us, one who is an expert in medical science as well as yoga and allied traditional systems of medicine. In this context, I would like to hear from you what is anatomy and what is physiology, and how do we understand these two subjects of anatomy and physiology. Are they the same or are they different? How do they connect with each other? We would like to hear from you.
Yeah, good question. Anatomy in the context of layman or a simple student who wants to know about anatomy is different. Anatomy, physiology in the context of somebody who is expert, wants to study medicine and all those, that is different. So in each of this context, the gradation of anatomy and physiology are different. In some of the introductory cases, you will learn about very few, like 1 hour of one system you learn. So that will be a brushing up or introduction, what we have already studied before, either in 10th standard or PUC standard or similar grade elsewhere. So in this context of anatomy and physiology, what I will introduce was a basic one. So simple understanding, what I see in a body, if I see the structure of my hand, so the hand contains some bones, some ligaments, some muscles, and if I want to cut and study what exactly it is, so study of the structure, so then it will become anatomy. Same structure, if how it is functioning, how I am doing the flexion of the hand, how these fingers are folding, so that is called as function. So the study, the science which is dealing with the function is called as the physiology. The science which deals with the structure of a particular part of the body. Here I used a hand as a gesture. If it is a stomach or if it is a liver, so stomach left side, liver on the right side. So how, where is the liver situated, how it is situated, what are the surrounding structures of a liver, how it is connected to the gallbladder, and then beyond how it is giving a single pipe, connecting another pipeline or a duct from a pancreas, and then it is giving it as a common outlet, like we call it as ampulla of Vater. So this is a structure where I study, you are studying the liver, where it is situated, how it is dealing, looking around, and where it is hiding underneath of the diaphragm and all those. So that is called as anatomy. Same liver, if you are studying how the liver is functioning, how it is doing the detoxifying the body, how it is doing all other functions, storing of glycogen and all those. If you are studying the function in its innate nature, then it will become physiology. In a simplest term to tell you is study of a structure of a particular organ or a unit in relationship with its surrounding can be called as anatomy. The study of function of that particular organ and its surrounding, let it be chemical nature or physical nature. So then you are studying the function of it, either subtle levels or at the grosser levels. That will become a physiology. So in anatomy, it depends on if you are going for a system, digestive system. So then it will become systemic anatomy. So you are studying one system at a time, it will become a systemic anatomy. If you are studying one particular region of the body, so shoulders or trapezius or neck area, then it will become a regional anatomy. If you are studying just a gross structure of anatomy in its completion or totality, then it will become a gross anatomy. If same structure of the body I am studying under the microscope, then it will become microscopic anatomy. So like this, anatomy, the context of anatomy can differ based on the interest of people. So for a general purpose, I think it is a simple study of anatomy, where you study the structure or the organization and how it is situated in relation with the organ structure and how it is functioning. If you can do that, it's more than enough for you.
Now you mean to say that in anatomy, so there are different kinds of anatomy, as I was hearing from you, different classifications of anatomy. You were saying about the systemic anatomy or regional anatomy or microscopic. So how can we classify anatomy into all this? Just in a brief thing, can you say, doctor?
The bad answer. Anatomy classification matters. So
About that anatomy is a study of the body structures and the relation to other organs in the body. You were telling about it. And you were also mentioning about the systems in your talk. You were telling about the digestive system and other systems. So how many systems are there in the study of the anatomy of the human body, how many systems are there, and also how does this formation of the system starts? So is it just like that suddenly the systems have come, or how the formation of system starts, and then finally how many other systems that we have in our human body?
Yeah, good question. Again, let you be a student of general science, scientific studies, anything. Let you be a student of nursing, let you be a student of fitness training, let you be a student of yoga, or any allied science which is dealing with health or movement or exercise or dance, whatever it is. So everywhere the basic structure and function what we use is the basic foundation of anatomy and physiology. So in that context of studying, I think we should study, our study should start with the micromolecule and the macromolecule. So as everybody is aware of an atom, anu. So atom, it's components of the atom, the molecule, and then a macromolecule of cell structure, cell organelles we call, cell organelles, and then the cell itself. So in precursor to a cell is a basic structural and functional unit of the any living organism, or in our case human body. So basic structural and functional unit of the living body is a cell. So behind that, what are the components? There are atoms, there are microatoms, there are organelles, there is a cytoplasm, the liquid part of the cell is a cytoplasm. There are components which will do different activities. Some things will do a packing, some things will do a production, something will some will work as a messenger like RNA. So this constitutes in the form of organelles. So organelle is cytoplasm, and then it will be a cell. A group of cells which are doing a particular function will be a tissue. So small cell, tissue. So behind this micro molecules, atom to the cell. So beyond this will be a tissue. A tissue is a group of cells which is forming a particular function. So an organ is a one which is a group of tissues doing a dedicated particular function. And then organ system is a one which is a group of organs doing a particular dedicated function. For example, digestion, function of digestion and excretion. So there are multiple organs involved. Esophagus, stomach, your mouth cavity, your small intestine, large intestine, all these components. So in that sense, the hierarchy goes like atom, all other components, organelles, cytoplasm, cell content, cell, organ, organ system, and then organism. So the entire living structure. So this hierarchy, if we study, in this hierarchy, everything you study in the structure is anatomy, everything you study in the function is physiology. Physiology in a normal context. The pathology means you are studying the disease, causative organisms, and how it is affecting different organs. If you are studying the causative organisms on the disease aspect, then it will become a pathology. So anatomy, physiology, and pathology. So as a yoga student, even if I study 200 hours or 500 hours basic yoga student, we skip this particular topic altogether because this looks difficult and we don't want to take it up. Most of the yoga teachers usually they'll skip this anatomy and physiology. But when you're doing all the process, all the asanas, everywhere the tendons, ligament, muscles, which joint, everything is involved. So in that context, you must have the basic foundation knowledge, which is difficult to study. I agree. Coming from a non-medical background, coming from a non-science background, it will be much more difficult. But we have our own body and we eat every single day, and if we don't know the digestive system, for example, so at least the basic of that, so it is not acceptable. So yoga, the knowledge of asanas, knowledge of pranayama, knowledge of mudra, bandha, kriyas, you already have it in its technical aspects of a classical yoga tradition. With that, if you have the knowledge of little bit of anatomy, we are not here to teach you like a MBBS doctor or a BMS doctor or a medical doctor where they'll go deep into anatomy. We are not into that. And we are also not into a study where after MBBS you study anatomy only as a MS or MD physiology only. So there will go much more details, So we are not into that. So we are into a basic part of anatomy and physiology which is in correlation with yoga, which will make you as a better yoga teacher, where you will be able to help your client or the patient much better than a routine teachers training program yoga teacher who is not aware of anatomy and physiology.
So what are the different systems in the anatomy and physiological aspects? You said how from cell, from the micro level, how it develops cell to tissue to organs, and then organ to the organism itself, the different systems. So what are the different systems in the human body as such, what we can see? What are the different systems that we see? Can you
Still recording?
Yeah.
Just you can give a pause and write it down.